A lot of people wonder, when's the right time to get tested? Should you get an STD test right away, or is it better to wait? Well, that depends. Get tested today if you've had more than one partner in the last year and you've had unprotected sex. But if you've had sex with someone recently and want to rule out STDs from that encounter, get tested in 3 weeks from that date, and then again in 3 months. Here's why. All STDs take time to become detectable. This time period is called a testing window. It's the time between getting an STD and having it show up on a test. For example, let's talk about Alex. On Saturday, Alex had sex with somebody and he didn't use a condom. And now, on Monday, he's getting worried and wants to make sure that he didn't get anything, because STDs don't always have symptoms, so he wants to get tested. If Alex got an STD a week ago, it may not be detectable yet. Our doctors would tell Alex to wait until 3 weeks after the day he had sex to get tested, if this was the only time Alex had an unsafe sexual encounter. But this wasn't the first time Alex didn't use a condom. Things happen, and for Alex, things happened a few times over the year. So, here's the recommendation. If you've had more than one partner in the last year and have had unprotected sex, get tested today. But if you are really worried about what happened, let's say 2 days ago, set a reminder to get tested in 3 weeks from that day, and then get tested again in 3 months. Why 3 months? Well, STDs like HIV and herpes take a longer time to develop, so you want to make sure you don't get what's called a false negative. This can happen if you get tested before the infection is detectable. So by waiting 3 weeks and then testing again in 3 months, you'll increase the likelihood that you can pick up everything at the right time. Thanks for listening, and we wish you the best.